Well, I think that it's really important for patients to maintain their independence and their dignity and the control over every aspect of their lives that they can for as long as they can. But none of us, whether we have a brain tumor or other neuro-oncologic condition or not, are ever guaranteed that we'll always have that ability depending on what happens to us. So I think it's important, not just for brain tumor patients, but for all of us to designate somebody that we trust to make medical decisions for us if we're unable to in that moment. And that should be somebody that knows what we want, that knows us well enough and will be our advocate to, carry out our wishes. So I think that's very important for people to do. I think that it's really hard to go to a neuro-oncology appointment or a radiation oncology appointment or any of the appointments that people have to go to by themselves. So I think having somebody with you when you go so that you have another set of ears to hear what the doctor's saying or to hear recommendations or explanations of things or options is important too. And, obviously you want to have your closest loved ones with you, but, sometimes that person may or may not be the best person in regards to remembering medical information. So, you don't want to have such a huge crowd in the room that it overwhelms the room, but at the same time, you want to have somebody with you, and usually the same person or close to the same person that can help you remember what's happened in the room that day and what was said, so that you don't forget and you don't miss that might think of questions that you would ask, but in the moment you're not thinking of them. So I think that would be really helpful early on too, is to identify somebody to help you. Sometimes people get overwhelmed in their families when everybody's calling them all the time, like, how are you? How are you? What happened today? What happened today? And I hear from my patients all the time, like, I'm overwhelmed. I know they mean, and they mean well and they want to do something and they want to help, but sometimes I advise my patients to maybe have one spokesperson for you, for all those friends and family that might be clamoring for information, and you let that person know what's going on up to the degree that you feel comfortable with, and then that person can disseminate to the rest of them and just make it clear, because you've got to sort of protect yourself. One thing I try to tell my patients is that the whole point of putting them through all of this aggressive treatment, whether it's surgery or radiation or chemotherapy or clinical trials with vaccines or immunotherapies or whatever it is to try to keep their lives as normal as possible, not mess it up as much as possible. So you want them to sort of learn how to, as best as they can, and it's heaven knows it's imperfect, to try to live with their disease instead of sort of becoming their disease, and to try to keep their lives as normal as possible, knowing all along that it's never quite the same again. And one of the ways to do that is to sort of protect yourself from constantly talking about it, unless you want to talk about it a lot. I mean, there may be times where you really need to talk about it a lot with a lot of people, and that's great, but sometimes that can be wearing and take you away from other pleasurable activities. So I think arranging for somebody to be your spokesperson sometimes can help some people too.